You got sick last week, maybe a headache, maybe a fever, and within an hour you had swallowed something that took the edge off. A pill so small you barely noticed it going down. Manufactured in a facility, tested across thousands of clinical trials, delivered to a pharmacy shelf, and sitting in your medicine cabinet waiting for exactly this moment. Now imagine that cabinet is empty. The pharmacy doesn't exist, the doctor doesn't exist, the hospital doesn't exist, and your fever is climbing. What do? For 300,000 years, that was the only version of this problem that existed. And here is what almost nobody tells you. They did not just suffer through it, they fought back. With a level of sophistication that modern medicine spent centuries dismissing, and is only now beginning to take seriously. Start with the oldest evidence, because it will immediately destroy everything you think you know. In a cave in Spain called El Sidrón, researchers extracted hardened plaque from the teeth of a Neanderthal who died roughly 50,000 years ago. When they ran it through mass spectrometry, they found traces of a specific plant, poplar bark. Just poplar bark. Not food, not something that grew near the cave entrance by accident. Poplar bark contains salicin, the naturally occurring compound that chemists in the 19th century isolated, refined, and eventually turned into aspirin. A Neanderthal was deliberately chewing the botanical precursor of aspirin 50,000 years ago. That is not luck. That is not accident. That kind of knowledge, specific enough to select one particular bark from an entire forest of options, does not come from a single individual's experiment. It comes from a tradition, generations of observation, generations of trying things, watching outcomes, keeping what worked, and discarding what didn't. It comes from something that, if you encountered it today, you would call a medical system without hesitation. But plant medicine was only one piece of it. And here is where the story takes a turn that most people are completely unprepared for. Trepanation. The practice of cutting or drilling a hole through the living human skull. It sounds like something that should have killed every single person who experienced it. And sometimes it did. But the archaeological record of trepanation stretches back at least 10,000 years and has been found on every inhabited continent. More importantly, a significant proportion of the skulls show bone regrowth around the edges of the hole. The patient survived, not for a day, for years, sometimes decades, long enough for the bone to partially close. A surgical operation. Stone tools, no sterile environment, no anesthesia in any modern sense, no germ theory. And people lived through it repeatedly, across cultures separated by oceans and thousands of years. These practitioners knew something. They understood enough about skull structure to make the incision survivable. They had techniques, refined across generations of practice. Now here is the part that changes the whole picture. Ancient healers were not just treating the body. They understood something about illness that modern medicine ignored for centuries and is only recently beginning to recover. When someone fell sick in a hunter-gatherer band of 30 people, the entire group mobilized. The sick person was not isolated in a room. They were attended to, continuously, by everyone around them. The healer performed their work publicly, in front of the whole community, embedding the sick individual at the center of collective attention and collective intention. Recovery or death both happened in full view of every person whose survival was bound up with theirs. Researchers studying psychoneuroimmunology, the science of how psychological states directly affect immune function, have established beyond serious dispute that social isolation measurably impairs immune response. Chronically lonely individuals show elevated inflammatory markers and significantly worse outcomes across a wide range of diseases compared to socially connected individuals with identical diagnoses. Ancient healing rituals were not superstition dressed up as medicine, but none of this prepared people for everything. Infections that a single antibiotic would resolve in 3 days killed people in weeks of mounting fever and spreading inflammation. Broken bones that set badly left people permanently disabled or in chronic pain their entire lives. Childbirth killed women in numbers that are almost impossible for modern populations to comprehend. Parasites, tooth abscesses, contaminated water. The ancient world was not a gentle place to be ill in. What the healers had was not enough to fix everything. It was never going to be enough to fix everything. Willow bark for fever and pain. Yarrow to slow bleeding from open wounds. Honey, which contains natural antibacterial compounds, packed directly into infections. Artemisia plants for fever, the same botanical family that produced artemisinin, the most effective treatment for malaria in the modern pharmacological arsenal, discovered by a Chinese researcher who won the Nobel Prize in Medicine, specifically by going back through ancient herbal records and finding what ancient practitioners had already worked out. The knowledge was in the plants were in the tradition, and the tradition was assembled across thousands of years by people with no microscopes, no chemistry, no theory of disease, and yet a track record specific and consistent enough that modern pharmaceutical companies systematically mine traditional medical knowledge as a primary source for new drug development. The next time you reach for something to make yourself feel better, understand what that impulse actually is. It is not modern. It is 300,000 years old. It goes back to the first moment a person in a small group fell sick and the people around them refused to do nothing. Before theory, before chemistry, before any framework more sophisticated than the bond between people who needed each other to survive. They fought back with everything they had, and more of it worked than you will ever be taught in school.